Chemotherapy-free regimen is definitely a high aim and a very important aim when developing and improving CLL treatment within clinical trials. However, we should always also consider that it is not an end of itself. So chemotherapy-free means that we want to particularly avoid the toxicities and the poor quality of life that patients may experience when they are treated with chemotherapy. However, if the alternative is a chemotherapy-free regimen with high toxicity, with long-term adverse events and with low quality of life, then we should rethink whether chemotherapy-free is really the right approach. And we should also consider that, for instance, at the moment we see that patients with distinct characteristics like mutated IGHV status seem to have long-term remissions when treated, for instance, with FCR, when they are fit and previously untreated. And we've seen patients in the data with the longest follow-up who have been in remission for over 10 years when they have received FCR in a mutated IGHV setting. So we should really check whether the long-term results of some regimens is maybe more favorable for patients when treated with chemotherapy than without chemotherapy. But at the moment we see that there seems to be, in large phase 3 trials, a sustained benefit for patients treated without these conventional chemotherapies and still having high efficacy and even better tolerability than the chemotherapy regimen. And ultimately we have to look on quality of life data. So do the patients feel better when they are treated with these alternative novel agents? And we should therefore particularly look on the patient's preference and their reported outcomes.